Hi viewers, welcome back to this channel. And video goes to anyone parent uh, who has been blessed with boys, men. This video is for you because you are going to I'm going to shed light on some of the things we've seeing. Some call uh, testis swelling, testicular torsion, and orchitis. Orchitis or testicular torsion, and the common causes of this swelling. For man, you happen to have your test, a single testis swelling, an abrupt swelling of your test. Rarely does it attack both testes, but testicular normally affect one test at a time. Rarely do you find that both of the are swollen. So testicular torsion is a medical emergency which need to be assessed within the time it has occurred, from 1 hour to 2 hours. Most men lose their testicles. This is because when testes are twisting, normally when you just look at the testes, there is a motion that happened to them. And when a vertical cord that is supplying your, when it twists, it's a very painful situation. And this is what we are saying is not addressed within 1 hour to 6 hours. You might lose your testes forever, regardless of the other one being untouched. This one, if it is not addressed properly, you might lose it completely. So testicular torsion, condition where your spermatic cord twist, block, or cutting supply to testicles, severe pain as a result, nausea, and sometimes vomiting. We have something else we call orchitis. Orchitis, rarely do they or does it happen on its own. We find that we have something we call hemorrhagitis, where your epididymis and testes are inflamed or swelled. Mostly this is a result of an infection, STI, which can be protected when you have pointers, or when you have issue of your partner, or you doubting something, so to have a protected sex. So orchitis normally happen when you have an infection. Infection is affecting both your testes and your epididymis. So when you have that infection, you're going to find both of your testes might be swelled on it as a result of infection. It can occur in one of your testes. You find that swelled or inflamed, sort of that infection, STI. We have others, the causative, that affect both adults and I don't know whether to call it kid or babies, but most happen to both. The possible causes of this, we have others. We have something we call PD. We have something we call edema or filled up or fluid buildup, and this may be a sign of congestive heart failure. Edema, that is a collection of fluid in your testicles or the scrotal part. If you have that, that may be as a result of congestive heart failure. We have something else we call hydrocele or hydrocele. This is normally painless fluid buildup in your scrotum, and these normally affect babies or baby. We have inguinal hernia. Inguinal hernia may result to your scrotum swelling, fatty tissues or intestines poke into your groin due to your maybe a loose lower abdomen. So we have said that, and we also have spermatoceles or spermatocele, which is caused by a fluid-filled cyst above or behind your testicles. That can also cause your testis swelling. We have testicular cancer, which is this is gradual, usually affect one testicle and rarely both. We have trauma. Direct strike on your testis can cause them to swell. We have tuberculosis, a rare bacterial infection that may cause swelling. We have said it is rare. And we have the last but not least, the varicocele, swollen veins in your scrotum. So if you happen to experience, you as a man who is a parent, a woman, you might be a single mother, a single father. So if you happen to hear your baby or you yourself experience any of the above mentioned causes, just rush and see your medical provider or healthcare provider near you. So most deadly one is testicular torsion. For the others, swelling might occur, but for the testicular, that need immediate medical attention. Otitis may be resolved by antibacterials after maybe you have been examined or the case has been assessed, and the causative is not the spermatical coid twist. The rest can be resolved with drugs in our hospital and also in our pharmacies, but avoid buying painkillers, over-the-counter painkillers, when you have either of the above mentioned pain in your testes, be it mild or severe pain in your testes. Don't rush buying or taking. You can just take a painkiller as you prepare your way to hospital to have them checked. This, if you have both of them removed, as a man, you're going to lose your fertility capabilities. If you lose one of it, you might retain your ability to fertilize or have children, but you're going to suffer other unwanted effects like low sex drive, growing of breast growing in men, which we call gynecomastia, as a result of testis removal, because this is going to affect your testosterone levels. And we say that testosterone is an androgenic hormone that is made basically from your testes. So it is also it's very crucial and paramount to take care of your testes, both for your baby and for your man, and for the man, you yourself. So that is that for this video. If you have any question, that just see the comment section. Share your question. Share this video with your friend, and most importantly, don't forget to subscribe to Kim Health channels, as more content like this, medical related content, is still going to trickle to educate one another and to shed light on the things that happen oblivious to our life. So stay tuned. Thank you for watching.